round 6, we have another question from an NUHW member. This is from Maria Martinez. She is a nursing assistant in Marin County, and she says, I work at a chronically understaffed nursing home. She works for Bria's Healthcare. She writes that the company's patient care violations are well documented, that its CEO was called a serial violator by the State Attorney General, that the Department of Public Health has blocked Bria's from obtaining a permanent license to operate 5 more nursing homes. But despite this, it is still operating nursing homes through provisional licenses. Here is the question, and it doesn't have to be, and should not be Bria specific, actually, because that's not the point. But as governor, what would you do to ensure that companies committing violations cannot buy up more nursing homes, and that when conditions get bad enough, chains are stopped from doing business in our state? And that question goes to Delane Easton first. I'll repeat it. What do you do to ensure that companies committing violations cannot get more nursing homes, and that when conditions are bad enough, they are stopped from doing business in California?
As governor of California, I will join shoulder to shoulder with the Attorney General of this state to ensure that the laws of California are followed. Look, I have a 97-year-old aunt who's in a nursing home, and I know, in fact, that she's getting very good care because we all hang out there. But at the end of the day, I've also met people whose parents and grandparents are in abysmal situations. It is unacceptable for the state of California not to be nimble as can be. Of course, you shouldn't be allowed to open more nursing homes if you have violations of the ones you currently operate. The problem with common sense, Mark Twain says, it's not very common. So let's apply a little common sense here. Yes, we need more nursing homes, but they need to be wonderful places where people want to be, where there's engagement and interest and an opportunity for safety and health. We can do this, and we can put a lot of people to work, and we can improve the wages and the conditions together if we have an attitude that these people are our friends, our neighbors, and our fellow citizens.
Thank you. Gavin Newsom.
Yeah, I mean, one way to do it is continue the unionization efforts around the nursing homes to improve conditions, which I think is front and center in this debate. No, look, it's all about accountability. It's all about transparency and making sure, look, if there's a bad actor, you got to call that out. And you obviously don't want to replicate those kinds of conditions in subsequent investments. That's common sense. But let me just, if I may, and this is not getting off topic, I think it's quite on topic. We've got a crisis in this state no one was talking about, and that is this silver tsunami. We've got an aging, ingrained population. The issue of nursing home and care is got to be front and center in our debate, and we're not talking enough about the fact that you're going to see in the next 10 years a 78% increase in the number of people 65 and over. We're actually going to see a decline, a modest decline in the number of young people over the course of the next decade. We have an LVN shortage issue, an RN shortage issue. We're almost bedlocked as it relates to providing skilled nursing facilities and these kinds of more broad care environments. And I think it's incumbent upon us to put together some strategic thinking along these lines and make sure that we're there for our seniors who have done so much for the state.
Antonio Villaraigosa.
Well, I'm part of that silver tsunami.
I just wonder, we've wandered already. I want to remind you of what the question is. When conditions get bad enough, what, as governor, can you do to make sure that they don't get business in our state?
Yeah, I wrote it down. Thank you.
Good. Thank you.
As I said, I'm part of that silver tsunami, and I think Gavin's absolutely right. It's here. It's coming, and we got to do something about it. And I am prepared as governor when you think about it, the responsibility for elderly care is the responsibility of families and government. So if someone in the private sector is making money off of that, at a minimum, we have every right and responsibility to say, you have to be a responsible actor. You have to provide that care in a quality way. You have to ensure that your employees are treated well. And so as governor, I won't allow them to expand. Habitual violators will not be allowed. Work with the legislature to ensure that we have laws that can, with teeth, by the way, and work with your union to do the same, to make sure that they don't get away with with murder.
So your answer to the question is you would pursue legislation to give.
Well, I think that's what you'd have to do.
Okay, thanks.
You couldn't do it by edict.
Yeah, but I think that's the kind of concrete answer that the questioner and the union member was looking for. Let me take it to John Chung, same question.
Yeah, sort of referencing the questions from earlier on, I would hold them financially accountable. You have to measure whether they're performing, and if they're not performing, you have to make sure that you start pulling away pay. I'm also aggressively going to make sure that we push transparency. You know, how are these centers, how are these different healthcare providers performing? We want metrics that are clear. What we don't have in the healthcare market is the ability for individuals to measure the performance that's being delivered, what type of services, and how much they're being reimbursed. So I think we can change it through law. We can change it also through market opportunities. What I also would do, taking from tax principles, is if you have bad actors, we want to make sure we identify those bad actors so they can't create subsequent companies, right? We want to make sure that they correct past incorrect behavior so that, and before they want to go out and start new businesses in that same line of field, that they can engage and evade their past misbehavior. They have to fix it before going forward.
All right, thank you. I'd like to just pass the question one more time by Delane and Gavin, because I think it wasn't until we heard from Antonio that we really got specific about what would you do as governor to keep these chains from operating. So Delane, can you take 30 seconds just to address that question? And it's fine if you say that you reference I would do the same as your partners, but I just want to get a sense of where you would stand on that.
Yes, first, work with the Attorney General to prosecute the people that are not following current state law with violations. Second, sponsor legislation that makes sure that these people cannot open other facilities when they aren't maintaining the ones they've got. This is common sense. And third, be more supportive of those agencies that do the oversight, because, in fact, we need to do that. I will also say, finally, yes, we need to build the union movement even stronger among healthcare providers in the state of California.
By the way, there are a lot of laws on the books. It's a question of enforcing the laws on the books and making sure that the folks that are appointed to these positions of oversight are doing their job, which is another executive function. So, we could pass some new laws. And by the way, I'm open to argument in terms of areas where we can improve some of the existing laws. But Delane's right. I mean, it's all about accountability with the Attorney General's office, but also accountability as it relates to our public agencies to make sure that they're doing their job at a grassroots level, and we're calling out the use and misuse of public money.
Let's take a few more minutes then on the point you just made. The laws, Gavin, you're saying the laws are there, they're just at this point not adequately enforced. I want to take that down the panel. Why do you agree with that assessment? And if you do, I'm curious to hear, Antonio, why you think they're not being enforced.
I'll be truthful. I don't know if the laws are currently in effect to allow you to do that. What I'm committed to is to making sure that we do have those laws, and so that's my answer.
What about you, John? The question being, to take Gavin's point, that the laws, there are lots of laws, he said, and the question is, are they being enforced? And his point being, number one, there are lots of laws, and no, they're not being adequately enforced. What about that? Why would that be the case, and what do you do about it?
Yeah, so the answer is I don't know, but I participated in underground economy seminars when I was the Board of Equalization and State Controller, so I would bring those various agencies together to have those discussions. It's been written about, but in my leadership, I've created interested parties meetings, so I would bring in this union and others to see which laws are being enforced and which laws are not being enforced, have them meet with the appropriate personnel within state government to make sure that we're pursuing the full spirit and letter of the law.
Delane, Easton.
When I took over the Department of Education, it was a mess. There were people on IBM computers and Apple computers couldn't even email each other. We had people retired on the job. There was a lot of immoral behavior, but also a lot of demoralized people. So I brought in the most diverse leadership in the history of the department, and in fact, we moved the needle dramatically for children and education. We streamlined bureaucratic procedures. We put people on a mission, and I still have people come up to me and say those were the best 8 years I served in the state government because everybody was on a mission. We need to make sure that those agencies that do the oversight over your hospitals and your nursing homes have people on fire to do the right things for all of you, but especially for all those patients that are not getting the kind of care they deserve in California.
And why is it not happening?
Well, I really do think that there are some agencies of the state government that are not very nimble right now because the people are demoralized. We need to get people on their toes again. People need to be on a mission. Government of the people, by the people, for the people. And that's not happening in too many agencies in California.
And Gavin, this line of questioning started with you.
Yeah.
Why do you think that the laws aren't being enforced?
There are a lot of people who have different opinions on that, including folks that are on these oversight bodies that frankly have the industry's interest at heart, not necessarily the workforce or the patient's interest at heart. But look, at the end of the day, I mean, the best answer really is a unionized workforce where workers have a voice and workers are front and center calling these things out and then supporting the efforts of unions like yours in advancing litigation to the extent that that's the course of action or the recourse to actually solve problems. It's unfortunate so often you're on your own, sitting there wondering where the heck the state is, financing these legal actions, forcing those employers eventually to mitigate those issues, and you sit there bewildered, saying where's the local government, where's the state government, and where's the federal government that also has a role to play in terms of that. So it's, again, in question. I know it's a cheap answer, but it's a really important answer, and that is it's a question of leadership. It's a question of commitment. It's a question of willingness to engage in these issues, to have two-way conversation, and to make sure that we don't wait till things fester and we don't wait till problems become acute.
Thank you. And that concludes round 6 of our questions. And now we are